Hello, Shane. Now you're standing outdoors. What's the latest measures there? Are you required to wear a face mask?
Well, officials here are recommending those in public places to wear face masks, but they are hard to come by. There's been a mass shortage of those. But to give you an idea of where I'm standing, normally on a weekend like this plaza here in central Seoul would be crowded with protesters and ralliers, but the government has banned public rallies. You can see announcements being made that all public rallies are banned under the law, under the contagious disease prevention law here in South Korea. But officials here are saying that this weekend will be a, quote, critical juncture in this fight against the spread of this coronavirus. Again, we saw nearly 600 new cases, bringing the total number close to 3,000, but 90% of these new cases still remain down in the southeastern part of the country in Daegu. And of course, 80% of those cases in Daegu are connected to this one church. And that's why officials have been very ambitious to try and test every single member. There are 9,000 members in this Daegu branch of this church alone. They say they're about 88% complete. And that's why we're going to see numbers continue to balloon here for the time being. But again, the focus is in Daegu, and that's why officials have delayed the start of the school year for another 2 weeks after a week delay. That affects 800 schools down there. But again, the focus is to try and determine who is showing symptoms, who are patients, and to try and isolate these people to try and stop the spread. Pando?
So as you just mentioned, Shane, the current focus is on Daegu, but nationwide, what's the common mood there? Do you think people are actually vigilant enough to this virus and its damages?
Well, absolutely. I mentioned the masks before, but as far as officials are concerned, the goal is to isolate and to determine who has this virus. That's the first step in this fight. And global experts here have really commended health authorities here for being aggressive and having the capacity to test tens of thousands of people. Close to 6,000 tests are occurring every day, and you have to trace that back to the 2015 MERS outbreak, the Middle East respiratory syndrome, where South Korea was hit very hard there, the most number of deaths outside of the Middle East region. At the time, I remember reporting on that, and South Korean officials were not equipped. But this time, we know that officials have been ahead of the curve, making sure to designate safe hospitals that people with symptoms or showing symptoms could go to, mass notifications by smartphone where you can see if you're in an area where a confirmed case has been or a patient has been recently, you get that notification as well. So again, testing kits have been approved very quickly by the Food and Drug Administration here, and it also helped to have to know that China was really going through this well before. Back in November, South Korea's first case was determined on January 20th. So that's why you might see the ballooning numbers here, is that testing is being done very rigorously here in South Korea.
Thank you very much and take care. Our correspondent Hahm in Seoul.